Dr. Seth Silverman, who is a forensic psychiatrist, also joining us this morning. Dr. Silverman, they've identified, apparently, in the pituitary gland, a molecule that is responsible for stress, for anxiety, for depression. Excitement about that, I guess, because now we can develop drugs that maybe will better take care of those kinds of problems. Are you excited about this? Are you on board with this?
Well, I'm excited about the concept. One of the problems is that the article is full of it. And it really, although it says that, there is no information that substantiates that allegation.
So, so the article that we sent you, because we want your expert opinion, you believe is nothing but a bunch of bunk.
Well, I think that's putting it nicely. They have a lot of terms, a lot of concepts in here. I think when the dinosaurs were around, or when I was in medical school, most of these concepts were elaborated, taught, and I was tested on. What they've done in this article is, first of all, they haven't quoted the authors accurately, and the authors have taken a bunch of old information, put it together in a way that makes sense, come up with another term, but give no data to substantiate it, but are very clear to promote themselves at the same time.
So, and I guess, thank you for just blowing this whole segment out of the water. But you know what? That's why we have you on, and that's why we talk to you, because I look at this and I think, oh well, this is interesting. Why aren't we hearing more about it? And you're pretty much laying it out. You're not hearing a lot more about it because it's a lot of nonsense. So let's talk about people that have depression and anxiety and stress. There are ways already and medications already that address those kinds of concerns. Best to talk to somebody like you and find out exactly what you can do.
Can I backtrack just 1 minute about the quality of this article? There is a press release the day before that this particular company received money from another company for making this announcement.
We're talking with forensic psychiatrist Dr. Seth Silverman, and we were talking about this stress molecule, this misery molecule. He's pretty much debunked that, and that's why we have Dr. Silverman on. So if you truly have depression and anxiety, in all seriousness, it is nothing to laugh at. You really should talk to a doctor. And what are the things that you would recommend that folks do?
Let me emphasize the tools that we have today are phenomenal compared to what was available as little as 10 years ago. We don't make the cover of Time too often because we're not cutting on people and doing all kinds of things where you can see something in a day or two. But we have very specific, focused medication that we know how to use without addicting people. We have short-term therapies that have actually been refined to the point that they can help people with these kinds of problems in as little as 12 weeks that are self-limited. You don't have to be in analysis like some other people that I know for 15 years to get some results. So the technology's there. It does employ some of the information in this irresponsible report, and it's a gift and it's a pleasure to be able to practice today because of how much we can help people.
Dr. Silverman, I thank you for coming on, and I love the fact, I was telling you off the air, your candidness and your candor. It is refreshing. Forensic psychiatrist Dr. Seth Silverman joining us this morning. Doctor, thank you for your time. We sure appreciate it.
Thank you. It's a privilege.